Welcome in. You're listening to Medical Spa Insider presented by the American Med Spa Association. We are happy to have you with us. This week, AmSpa founder Alex Thiersch welcomes Dr. Terry Dubrow, board-certified plastic surgeon and television personality, for a conversation touching on the rise of peptides, the importance of legal compliance, and what Dr. Dubrow has learned as a consultant for the California Medical Board. AmSpa members can access an additional 15 minutes of exclusive content from this recording session by logging into their account and clicking on Learn in the left-hand column. And if you want to hear what Dr. Dubrow has to say about the latest peptide innovations and enjoy more on-demand resources, become an AmSpa member at americanmedspa.org/benefits.
Okay, welcome everybody to the program. Thank you all very much again for joining us on the AmSpa hotline today. We are very, very pleased and grateful to have one of the original husbands from the original house from the house with the Real Housewives. I have to say that's what you're best known for. You're moonlighting as a plastic surgeon and an obesity medicine doctor, I think, is kind of what we like to say. And Dr. Terry Dubrow, I first of all appreciate you joining. You've been doing the rounds. You've been do a lot of podcasts, a lot of media appearances, talking a lot about peptides. We are going to talk about peptides for the bulk of the podcast because it's such an interesting topic. But I have to say, before we jumped on, I was doing some research. Your wife Heather is still on the Real Housewives of Orange County, which I think was the original iteration of the Real Housewives, which is fascinating because we watched it when we were down there back in the day, my wife and I. My wife was ecstatic when I said we were doing this interview. She's probably going to kill me and be embarrassed that I'm even asking about it. But congratulations on everything. How have you been lately?
I've been great. Yeah, she's been on the Housewives. It started 20 years ago. It's their 20th season.
I mean, that's right? Crazy.
And I know. And by the way, so to be a house husband, I know we're not going to talk for an hour about housewives and being a house husband, but it's a very tricky navigation. And it reminds me in many ways of the navigation you have to do when you deal in the world of peptides, which we're always going to take a deep dive. But I will tell you, I remember when I made the transition from they would note me in the media or in articles written or interviews, Terry Dubrow, husband of the Real Housewife, Heather Dubrow. Now, of course, they say Terry Dubrow, Botched doctor, which I thought, I've become the Botched doctor. It was like, when that happened, after 10, 11 seasons, 13 seasons of doing Botched. But it's funny because just the other day I did like 60 Minutes Australia, I think it was. It was a really intense
I saw
interview, which you can see on YouTube, about peptides. And one of the things, Dr. Dubrow, 60 Minutes Australia, peptides, Real Housewife husband. I went, I'm back to Real Housewife husband again.
You know what? I'll tell you what though. This will maybe bring this full circle, or maybe not. In which case, whatever. But I've been over this past summer because peptides have been, not only peptides, but just med spas have been front and center with a lot of the legislators and medical boards and nursing boards. I've been in discussions with a lot of the medical boards and nursing boards, pharmacy boards as well across the country. I've been speaking with them. I've given some speeches at some of their meetings. And what I do often is just educate them on what medical spas do. And I tend to give a quick TikTok history of what the medical spa and history of the aesthetic industry is. And I always mention Real Housewives, and in particular, Real Housewives of Orange County, because I think, and I would love your quick feelings on this, and then we can move on. I think there's a distinct line between the Real Housewives and them starting to do treatments on camera. And then also folks like you who are you're meeting with people on camera. You're talking about these treatments, the before and after, when folks really start embracing aesthetics and non-invasive aesthetics because of the Real Housewives. And then obviously you have the Kardashians and all that, but I think it's a tremendous, tremendous boost to our industry. So I don't know. What do you think? I think we should do a study.
Without question. No question about it. But where it's been particularly interesting for me in the last several years is, among the other things that I do, besides the TV show Botched, besides being a husband on the Real Housewives of Orange County, besides being a plastic surgeon, is I have a big medical legal component to my career. And I do a lot of medical legal, both plaintiff and defense, defending doctors and sometimes against doctors. But I'm a certified expert for the California Medical Board, and I have been since like 2000. And as you know, probably better than I actually know, this is a hotbed area for the California Medical Board and
Oh
other
yeah.
medical boards. The med spa and the way med spa conducts its business and the procedures that they may do and the supervision. And now peptides, of course, has thrown this incredible wrench into the whole situation as to how are we navigating through this, what's approved, what's not approved, what compounding pharmacies, where do you get them, who's prescribing them, so on and so forth. So the medical board, at least of California, has one of the things they're super focused on, as you are aware, I'm sure, is the way med spas conduct their business. And I do a lot of expert work for the medical board. I also do defense work for doctors and med spas, and have had many hearings in this area where I'm defending a med spa or defending a physician because of his participation with a med spa. So this is as you know, a regulatory area that has to be very, very carefully navigated.
Yeah. Yeah.
Right?
And we're just getting started, I think. And they're having trouble, as much trouble as we are, is figuring out kind of what to do and how to navigate it. And so let's kind of get into it, because one thing I was reading up, I didn't realize that you were board certified in obesity medicine as well, which I think leads into this. I didn't realize that was actually a board certification you could get. So that's cool. I mean, that kind of gives you a lot more insight than maybe a lot of other plastic surgeons or aesthetic medicine doctors do.
I think so. What happened was the GLP-1 drugs came out, and I obviously got fascinated with them because sugar and sugar's effects on the human body. And if you can manipulate and mitigate obesity, well, that's the number one risk factor for all 4 causes of mortality and so on and so forth. And then there was a lot of controversy. Oh, is it cheating? And is this safe? And I started interviewing in the media, and I was very pro GLP-1 drugs, the Ozempics and the Mounjaros and the Zepbounds. And then, I got in arguments with people like Jillian Michaels, who's a trainer who was on The Biggest Loser. And she said, they're so dangerous. And I said, hey, you're giving medical advice here. Back off. You should go to med school if you want to give medical advice. And then she said, well, you're a plastic surgeon. And I thought, okay, fair enough. I am an MD. I am board certified. I was board certified in general surgery in 95 and then plastic surgery. I should become a true expert. So I studied for a year, and I took the American Board of Obesity Medicine Certification exam, which, by the way, is not easy when you're a surgical specialist, because that's an internal medicine specialty. So I had to study endocrinology, nutrition, PCOS, all those things. And I'm happy to say I got a 94 on the exam. I studied like crazy, and I passed it. Now I'm board certified by the American Board of Obesity Medicine. And now I testify about obesity in court. And this is obviously a very particular interest of mine. And a part of that, as everyone knows who's listening, the GLP-1 drugs are peptides, right? So they're just approved peptides.
You should get a tattoo of Jillian Michaels on your back then, because she's kind of the one that led you there, right? I feel like.
Right.
So are the GLP-1s, because obviously that's kind of their peptides, and that's I think what started where we are, really. But is that what you've shown such an interest, and you've become such a voice, not only in the States but worldwide, for kind of how we go about thinking about peptides and regulating peptides? Is that what kind of spurred your interest in peptides? Because there's also a through line and a connection with aesthetics too, which I want to get into. When did your kind of excitement with peptides just in general become something?
So in plastic surgery and in surgery in general, obesity is such a potential risk factor. And not only anesthetically, but aesthetically, if you do liposuction on someone who's overweight, or someone loses weight after a facelift or a tummy tuck, or they need to lose weight, when these drugs came out, it was like, wow, this is one of the most significant advancements. I think it's the most significant advancement in the history of medicine, because it not only changes you internally in terms of the way your metabolism works, but if you can lower your visceral fat, the internal fat, lower your body weight, it puts you in a different strata risk-wise for surgery and longevity-wise. And plus, you look completely different. You look so much better. And that, of course, then exploded with the rapid weight loss. Now, all of a sudden, people have aesthetic issues that they never had before. They have the Ozempic face. Their face is deflated. Their skin is hanging. And it introduced a whole set of issues and problems that we never were introduced before. So I look, and by the way, I've struggled with my weight over the years, and I was the first one when it was identified that there was a drug that could decrease gastric motility and increase insulin sensitivity and work centrally in the brain and the satiety centers and make you feel full, and then beyond, and help you lose weight very quickly. And beyond that, all the other amazing effects of these GLP-1 drugs, not the least of which is like potentially treating Alzheimer's, preventing recurrent heart attacks, help you with liver disease, fatty deposits in the liver. This is it. I mean, this is everything. So I got immediately obsessed with it, and I became an expert in it. And then that naturally, I started, what is a GLP-1? Well, it's just a peptide. It's just small chain of amino acids. And then, I'm in Beverly Hills, right? Everybody is on the unapproved peptides. Everybody is on the injectable, the BPC 157s, the TB 500s, the Wolverine, the Stacks, the GHKC, so on and so forth. So this is the wild, wild west, right, in terms of longevity, health, and wellness. But it's so ill and poorly defined and so weirdly regulated and such a push-pull. I mean, the biggest change for me was what, in 2023, when the Biden administration said to doctors, yep, we're making it go from category 1 now to category 2, meaning you can't use them anymore. Stop it. Right? And you can't research it. And then everyone went, wow, we doctors are under potential regulatory jeopardy if we start prescribing these peptides. Oh, wait a minute. There's a loophole, though. You can get a compounding pharmacy to make them for research use only, FUO. And then we went, okay, so we get them from some compounding pharmacy that writes FUO on them, for research use only, right? Or whatever, research use only. And then we start prescribing them. And then that brings up, well, how does the medical board feel about that? What research are you doing? And then I, as an expert for the California Medical Board, started getting cases where the medical board's going after people for using peptides. No. So, how is the medical board in California looking at doctors who use peptides? Are they basically saying, and I have an appreciation for where it might be in this moment of time, are they saying, well, you really shouldn't be using peptides, doctors? They're not really saying that. They're more looking at the stuff the medical board looks at. Like if you're accused of a crime, right? You're Al Capone and you've ended all these people's lives. What did they get him on? They get him on avoiding paying taxes, right? Well, what does the medical board get you on? They look at your records and they look at a med spa's records and they say, okay, you're using these peptides. Well, we're not sure if we have a problem with you using the category of peptides necessarily, but are you documenting that you've told the patients these are for research? Are you telling them that they're unapproved? Where's the documentation? Are you making a diagnosis? Are you doing monitoring? Are you following up with them in case there's any? That's what the medical boards, in terms of med spas, are really focusing on. Are you practicing medicine? Because this is the practice of medicine, right? Are you doing it in the appropriate, within the standard of care way? And that seems to be what they're really focusing on now. What's interesting, and then we'll go back to what exactly what you want to talk about, forgive me, but one of the things that's very interesting, what was very interesting is there was a doctor who was prescribing a lot of peptides, but this doctor, rather than prescribing the vials and telling the patient, hey, you get the syringes, you get the bacteriostatic water, and you reconstitute the vial, the lyophilized vial, and you bring it up into a syringe, and this is how you do it. This doctor, for convenience, was doing it herself and giving the syringes to the patient. And I thought, okay, that sounds reasonable. Do you know what the medical board had a problem with? And I didn't realize there was a business and professions code that states if you're giving syringes now to patients, first of all, how are you inventorying them in your office? Where do you store them? And do you give it in a child-proof packaging?
Right.
And
Right.
you probably are aware of this.
I'm not. That not to that level, no. And plus then there's disposal too. I mean, there's OSHA, how are you disposing of them too? I can think off the top of my head.
Right, but the California Medical Board recently felt that there was extreme deviation of the standard of care for this physician who gives syringes to people that's not in child-proof packaging.
Yeah. So, all right. So first of all, I think that's really interesting because we talk all the time on this podcast about these exact issues. Like, it's like all of these regulatory issues are out there, but when the rubber meets the road, it's how does the medical board deal with it? What do you have to do as a medical spa provider, owner, whether you're a physician or you're nurse practitioner, PA, RN, whatever it is, working in a med spa, to ensure that you're providing within the standard of care and you're protecting yourself in case the medical board or the nursing board does come. And for peptides, it's doubly difficult because you have unapproved under the FDA, and you've got this kind of wild west contingent of stuff. It's not even really drugs at this point. It's stuff. And the California Medical Board is obviously one of the most strict and the most focused on medical spas anywhere in the country.
Right.
What with your experience with them, I'm just curious. So I've talked with them as well. What what's because I think your point is good. You have to kind of follow everything else, and you have to be within the standard of care. That all makes sense to me, and I think it will make sense to others. But at the same time, there's no real dosing guidelines, right? There's no long-term studies. There's no, we're really saying you can, I mean, there's prescribing for research purposes. So you have to have all the documentation, the consents and all of that. But you've said in some of your own podcasts that I've watched, the truth is we don't really know. We don't have the data. We don't really know what's going to happen with some of this stuff. To me, that just opens up, good, bad, or indifferent, a whole level of potential risk, irrespective of how well you document and how much and so that's kind of where I get a little bit nervous as a lawyer talking to folks about this. I'm curious what you think, what the medical board thinks about that.
So this is the sort of, I think it's hard to know exactly what the medical board thinks. You can get sort of an idea based on the accusations and the comments that they're making. And by the way, as you, I'm sure, realize, the way the medical board works for the med spas is, first of all, if you own a med spa, you're involved with the med spa, you have the microscope on you. Okay.
Yeah,
okay.
For sure.
So you want to make sure you're dotting all your I's and crossing all your T's. You're basically, aside from the two other things, which is, opioids and the sort of, inappropriate behaviors with patients, these are the top three areas that they're focused on. Okay, but that doesn't mean you can't do it and do it right and do it well. But you have to understand that you really have to focus on the nitty gritty and the basics of practicing medicine. That's number one. Number two, you have to acknowledge that you're practicing an area that's very unclear, and that the dosing, as you've said so beautifully, the dosing is unclear. The studies are basically not there. They're based on animal studies. And then when you stack them together, for example, when you're they don't like the stacking, by the way. We talk about the glow and the close stack. They don't like that because that's multiple drugs put into one vial, and they'll immediately, I don't want to get too lost in the weeds of the way they think, but they'll immediately make that repeated acts of negligence when you combine two drugs together. Okay, you can come in. So I would not stack peptides if you're a med spa. I would give each individual peptide, and I would always acknowledge, okay, that you told the patient there is no human research studies, the dosing is very unclear, and that none of this, as we work through the information and the data, this is an ongoing process. If you write all of that down, or you have boilerplate consents you give the patients that in very plain English state this, you're already 90% of the way there, okay? And they want to see that you've made a diagnosis. Like, for example, you can't just say wellness. My diagnosis is wellness. My diagnosis is longevity. That's not a diagnosis that the medical board will say is a reasonable diagnosis for which to prescribe a drug, okay? Because they're seeing this as the practice of medicine, the prescription of a drug. So they want you to say fatigue for, let's say it's, or tissue damage or pain in the joints, okay? And even though there's no great human studies for TB 500 or BPC 157, they want you to say left shoulder pain. Okay, assessment, diagnosis left shoulder pain. I'm going to use BPC 157, okay? We're going to use this starting dose, which, by the way, we've told the patient it's unclear, but it appears that this seems to be the most commonly used starting dose. By the way, when most commonly used is your nod to standard of care. And for those of you who aren't doctors or lawyers like you are and I am, the standard of care, the definition of the standard of care is very clear. And that is what a reasonable and prudent provider would do under similar circumstances. So basically, if you acknowledge this is what others who do this are doing, you've made a nod to this is standard of care. Okay. And so, but you have to very carefully, and most of this can be done with your paperwork before. You don't have to freehand extemporaneously write all this, but you should have I own a surgery center, okay, or I did. And we had, as you know, policies and procedures manuals that you have to keep up to date that allow you to keep your accreditation. If you want to own a med spa and do this very sort of out there field that's very under scrutiny by the medical board, you should have a booklet that's your policies and procedures booklet for peptide use at X med spa. And and there should be like 10 pieces of paper in there. This is informed consent. And it acknowledges that this is not an area that's new and burgeoning. That's one. Number two, there should be a history and physical. Every patient needs some form of history and physical that says this is a diagnosis, and it has to be an acceptable diagnosis rather than just wants to feel good or longevity or, and then this is the plan. And then a follow-up thing that all the patients get that says, okay, you're starting on BPC 157. These are things you can expect. These are things you should look for. And this is a number to call if there's issues. That kind of intense sort of follow-up, which, by the way, 98% of this can be handled in that policies and procedures book. And you can get, you give to every patient. Every patient needs a packet because this is what they're going to look at. How are you practicing medicine? Because this is the practice of medicine, and they're going to apply, as you know, as a lawyer, I'm sure this is ringing true to your ears. They're going to apply the Medical Practice Act to a med spa's prescribing of medications. So if you do it this way, even though we're still dancing around with unapproved drugs with no particular wonderful research, they, for the moment, don't really have a problem with that. Okay. The only problem, by the way, they would have, let me just give my opinion, my piece of advice, and I'm curious to see what you think about this. Don't prescribe Retatrutide. Don't do it.
Well, that's not even.
Do you know what Reta is?
I do. It's not even out yet, is it? Or is it out? Like, is it actually available?
Okay, so
I mean, it's the new GLP-1.
Okay, so let me just give you. Are you interested in me expanding on this a little bit? Because this is
no,
such an important
to the
thing to talk
extent
about.
that 100%. I mean, I think this is, from what I've read, and again, I know enough to be dangerous on this, but it's one of the most exciting new developments in GLP-1s and in weight loss medicine that we've had for quite some time, which is saying a lot given GLP-1s, right?
It's going to be it's going to be the first $1 trillion drug. It's Eli Lilly's new GLP-3, they call it. So GLP-1 is Ozempic and Wegovy, same drug. So then there's the 2 hormone one, which everyone knows is Mounjaro and Zepbound. That's GIP and GLP-1. Okay, all right. And then there's Retatrutide, which is GIP, GLP-1, and glucagon. This is the new weight loss drug. The difference is, because of the glucagon, it burns body fat and works so much better. It's like 28 to 30% weight loss in that same period of time, but you lose much less muscle mass. Okay. This drug has gone through phase 3 clinical trials with the FDA. It's fabulous. It's so fabulous that even when they released phase 3 clinical trials earlier on, like a year and a half ago, all the compounding pharmacists went, okay, this is the best drug in the history of medicine. We're making it right now. And everybody is on it. You can get Reta at a bodega store in Manhattan. They have a menu of things. Oh, by the way, a little warning. Don't have a menu for your med spa patients. Don't have a menu of BPC that they choose from. Medical boards don't like that.
They hate it.
Don't have a menu. They hate it. You make a diagnosis and you recommend options, okay? But don't give them a menu like they're at a restaurant. Hey, you want something for sleep? You want something for this? Don't do that. That's
great advice.
So Retatrutide is about to come out. It probably will be out first quarter 2027. Everybody's already on it. And I promise you, every med spa, well, I can't really say this. Most med spa, or a lot of med spas that are prescribing peptides, are prescribing Retatrutide. Don't do it. I'll tell you why. It's not that it's unapproved. It's illegal. It's completely and totally illegal. And Eli Lilly has sued the big peptide companies, and the FDA has said it's illegal. And the medical board, if they focus on you and they look at your practices and you're prescribing Reta, there is no defense that I have for you. None.
Now, why do you say it's illegal? Because it has not yet been fully approved, and therefore there's no off-label use. There's no way to compound it. There's none of that exists. Is that right?
It's not on anybody's previous bulk list. It's not on anybody's. Well, it may have some. It's just. I mean, look, you're a lawyer, so I would defer to you. Maybe I shouldn't use the word illegal, but I'm going to use it because it is.
No, I think it's smart.
But
I agree.
It's don't do it. Now, have I tried it? Oh, it's amazing. It's so good. I can't. But by the way, just so for your audience, I'm got these board certifications and these things. I don't prescribe any peptides at all. Zero. I'm too afraid. First of all, I'm a high profile doctor, and I don't prescribe them because I don't want to have to stand before the man and explain why I've why I've done this, because at the end of the day, I'm always afraid the medical boards and the regulatory boards can go, okay, you dotted all your I's and crossed all your T's. But at the end of the day, Terry Dubrow, you're prescribing unregulated. And I look, with you as the lawyer, I know I could mount a defense that said, look, these are not illegal. This is being done. It's the standard of care. Everybody's using them, including, the head of the, RFK Jr., Human Health and Services. So, but Retta, that's a different thing. That's a drug that's going through the experimental phases at the FDA, and there are patents on it, and you've got a multi-billion-dollar number one pharmaceutical company that is going to come after you, and it's illegal. Don't do it. There is no defense that we could mount to say that it was okay, particularly when you knew or should have known because of the recent media that it's illegal. In my opinion.
No, I think that's. I think that's right, and I do. Well, and it's. I mean, look, Retta is going to be. I think it's hitting the market. I mean, gosh, any time now, really, or early next year at the latest, I think,
Anytime.
and then there'll be kind of the same issues that we have now with the current GLP-1s, which is, can you make a justification that you need to alter it? And I don't know how that's going to work or not, but I do know that Lilly has been incredibly aggressive. And I think given what you're saying, they're going to be probably even doubly aggressive with this one. So I can imagine this is something we're going to have to.
But forgive me for interrupting, but at least when it's FDA approved, then the legality is more of a civil legality.
Right. That's right. No, that's right. That's 100%. 100%. You don't want to get into where you're, because at this point you're operating not even in a gray zone. It's absolutely illegal under the FDA regulations. So all right, what we're going to do right now is let's take a quick break for our sponsors, and then we're going to jump back in. I do want to bring this back to med spas, because I think you had some really good advice for med spas. I want to talk a little bit about kind of some of the non-physician providers too, because that's a huge part of our industry and how they should be thinking about this. Just 1 sec, and then we'll be right back. Thank you to our partners from Gloss Genius for sponsoring this podcast. Something no one tells you is the better your business does, the more time it takes to run it. More appointments and more locations end up meaning more hours spent on scheduling, charts, follow-ups, and marketing, instead of the time with your clients and staff, let alone your friends and family. But there's a better way, where you can keep growing and get more time back. Gloss Genius is the intelligence system that handles more of the work for you. Scheduling, payments, charting, marketing, staff management, and client follow-up, all automatically, working in the background to fill your calendar, grow your revenue, and keep clients coming back. Over 5,000 med spas and aesthetic practices already trust it to run their operations so they can focus on their vision. Are you ready to earn more and actually get your time back? Use code AMSPA at glossgenius.com for 50% off the first 2 months of their med spa and aesthetic plans. Thanks again. Now back to the show. All right, let's get back to it. Thank you again to our sponsors. We are here with Dr. Terry Dubrow, again, world famous house husband, and also pioneer in the peptide and GLP-1 space. So there's a couple things I want to get into, but you had some, I think, really, really good points, and something that I think those of you who listen to this podcast, we've actually said quite a bit, is that, where folks get into trouble with med spas is exactly as you said, is that they're not buttoned up, right? It's often not the first thing that's reported. It's everything else that when they start digging in, particularly in a state like California, they start digging in and they find XYZ, and then they really get after it, and then you get into trouble. What's your thoughts, if any, on non-physician providers like nurse practitioners, physician assistants, who are a lot of the times they're the ones who are running some of these med spas. They're kind of front and center,
Yeah.
and they're doing a lot of the work. They're doing a lot of the prescribing. A lot of the physicians above them are even the ones that are doing it correctly. They have the right protocols in place. All the same things you're talking about, the collaborative agreements, everything is there. Um, what's your thought and any insight from the your work with the medical board? How should med spas look when PAs or NPs start working with peptides? And is that a greater risk? I don't know. What do you think?
No, I don't think so. I think the greater risk is when the RNs and LVNs are working with the peptides, because a PA and a nurse practitioner can now prescribe these things. Okay. And then what's interesting, I'm sure you may be aware that they just changed sort of the scope of practice of a PA in terms of at least the California Medical Board recently, where they need much less supervision, which is good. You don't actually have to sign whatever percent of the charts as an MD anymore. You don't even have a delegation of services agreement with them anymore. You have a practice management agreement that's in place that allows a PA, which is good because PAs are amazing, much more autonomy, and nurse practitioner have incredible amount of autonomy. So just as long if you have a lot of PAs, but the most med spas that I've interacted with, it's there is one PA and a supervising physician somewhere out there who's not necessarily there, and maybe a whole bunch of RNs. And after a while, they may get a little sloppy, and then all of a sudden the patients are now coming in, seeing the RN. The RN is then making a diagnosis, which, as you know, an RN is not allowed to make a diagnosis, right? And then an RN is prescribing this drug, and it's basically patient to RN back to patient. And that's not okay. I mean, that's not okay. That's where now, if you have a PA there or a nurse practitioner there, and by the way, probably nurse practitioner better in terms of regulatory scrutiny, then great. Make that nurse practitioner see every single patient. A nurse practitioner can make a diagnosis, all right, and a PA can make a diagnosis, okay. But when you guys get really busy and they're not involved, and maybe they can say, "Oh, I came by and did a curbside, or I looked over the shoulder." That's a problem, okay. But I think nurse practitioners and PAs, they run med spas, and how often is an MD? And the medical board knows this, but the medical board is looking very carefully as to, are you basically just lending out your license so that sort of unlicensed or less licensed providers can now practice medicine using this, so everyone knows this, using your MD? That's the first thing they're going to look at. And okay, and when you're in the medical board interview and they say, "So when you had a problem with this person, who did you call? Which doctor did you call? Which PA? What was the and then that chain of command and information is broken." That's where extreme deviations of the standard of care occur and accusations happen. And they love the whole aiding and abetting, the unlicensed practice of medicine, and multiple gross negligent acts and so on. So, in every med spa needs a nurse practitioner or a PA who is standing there, who's going to say, "I'm responsible for diagnosis. I'm responsible for follow-up. I'm responsible for monitoring." And the nurses, like they do in hospitals or do in your practice, they are, delegated certain responsibilities, but only under your supervision.
Right. Right. And we've been, shouting that from the rooftops. And you're right. That's the main thing that gets people in real trouble, and the doctors too, because they get dinged for aiding and abetting unauthorized practice of medicine. And the reason I bring this up though is there's kind of looping it back. The FDA recently, not the FDA, the pharmaceutical group advising the FDA approved, a number of these peptides to be or recommended for approval, right? And
Right.
you and not only you, many physicians and others in the industry have said that part of the issue with peptides is that we're never going to get them FDA approved or studied really, because there's no incentive other than for some of these GLP-1s and weight loss drugs, which have happened, for them to be brought to market by the pharma companies, because there's no incentive. They're generally not going to be patentable, and therefore they're not going to spend the money to get them brought to market, which makes perfect sense. And then therefore, your position, I believe, from what I've seen from some of your other podcasts, is that we need to put this back kind of into the hands of the physician so that they can study it, right? And so it's better to have it out there studying it than to have folks getting it off of the black market where you don't know what's actually in it. And the reason I bring up the PAs and the NPs is that what we're seeing in med spas is that what's happening is you have a lot of very, very smart, enterprising, really, really interested NPs and PAs who want to be the ones to do a lot of this research. And I have seen some pushback from some physicians and from others to say, well, okay, yes, we understand that you can maybe do some of this prescribing, but there's not like, at some point, there's going to be all of this research and study on how peptides work and what the dosing is and side effects, all those things is going to have to be done over the course of, treatments of normal patients and studies, and then all the submission of studies to one another. In order for that to be done in mass, there's going to have to be PAs and NPs involved in that. And I feel like that bothers some people, and it doesn't bother me because I've talked to a lot of these folks and they're so passionate about it. But I don't know, what are your thoughts on that, if any? Because that's, I think, where this is going to be going. We're going to have to if we're going to get this studied, we're going to need people to study it, because we're going to have this research completed. It's not going to be done by the government. We're not going to have government studies of this. We're not going to have pharma do it. It's going to have to be done by providers. And so the NPs and the PAs I think, have a real opportunity to step in and fill that gap, which isn't necessarily something that they're accustomed to doing in other areas of medicine. I'm curious as to what your thoughts are on that, if they're going to have pushback from physician groups or from others.
Well, I think physician groups have to get over it. And I think it's still, PAs and NPs are smart. They know the medicine. They're the ones in the trenches administering these things and getting the feedback from the patients and really teaching us, okay, what different sort of peptides do and what different doses do in different kinds of patients. This is the thing. The way I view, because if you think about how is that going to even be possible? And all of a sudden, we're making drugs that we're no longer putting through the IRB. We're no longer putting through the FDA. Who's going to run these studies? I want people, my recommendation for people in the field, doctors, NPs, and PAs, is to think about peptides the way we surgeons think about procedures, okay? When we come up with a new procedure or a variation of a procedure in surgery, we don't run it through a placebo-controlled study with the FDA. We do the procedure. We then assess what our experience is with the procedure, and then we accumulate the data. Some of it's prospective, most of it's retrospective, and we write it up and put it in the literature as surgical literature articles. When you look at, a breast procedure that we do in plastic surgery, or a procedure that's done, a hernia procedure, again, nobody's entering an FDA study and getting a surgical procedure FDA approved. So it's completely analogous with peptides. Nobody's ever going to take a peptide and put it through a placebo-controlled study for the reasons you mentioned, right? So if we look at it like GHKCU is now like a breast augmentation done with under the muscle or on top of the muscle, or putting a piece of mesh in. And at this clinic, they've done 1,000 GHKCUs. We've looked at the records of 1,000 patients who've taken GHKCUs, and we see that at this dose, the incidence of this adverse effect was X. At this dose, the reaction was this positive and this negative, just like we do with a surgical procedure, and the articles are written up and published in the literature. I think if you look at it with that perspective, a sort of more procedural surgical perspective, then that provides the framework by which you can actually think, this is how we research these things clinically. And we write it, you have them look at the data, you ask, somebody, a PA asks a nurse, or they hire a college student to look at these records of these patients that had this peptide and start tabulating just the way we do in medicine for non-drugs, okay? And this is the way surgical and medical literature unfolds. And this is how we learn all this. So this isn't a new novel concept. We just have to look at them as if they're procedures that are done, and we collect the data in a similar way. If you do that, and the doctors just chill out and don't worry, nobody's stealing your peptides, nobody's taking money out of your pocket, because in my opinion, the doctors are very proprietary about this because they're concerned that this is yet another thing that's going to be taken out of their wallet. Okay. Oh my gosh, the NPs and PAs are going to get the lion's share of the revenue from this. Forget about this. This is a field that is going to change the world. It is changing the world. Soon, very soon, there will be a new peptide that will have some really powerful effect that no one's going to get FDA approval. But this new peptide with this new powerful effect will also potentially have a very powerful side effect. See, that's the thing with peptides, as you know. This is an area that nobody has really sort of locked down on too much in terms of regulations, because they're not like opioids. Nobody's dropping dead. Yeah, there's a couple people who've been put into the hospital in the intensive care unit. They've had anaphylactic reactions in the ER, but by and large, these medications, these peptides, are incredibly low risk. Okay. But there will be some peptides that come out that, whether it's melanotan, that now we find out, oh boy, it not only makes people tan, but people are getting melanomas. And the melanomas they're presenting with are far advanced melanomas. Okay, we need to know about that as quickly as possible. And the only way to do that is to let the PAs and let the nurses, the NPs and PAs do this and accumulate the data, and let's correlate that with any potential side effects. That is what we have to do, but no one seems to get it. But I must say, one of the very positive side effects of the medical boards, which they should do this, forcing the med spas to treat these drugs like these are drugs. You need to make a diagnosis. You need to tell the patients, hey, we don't really have good data. This is an unapproved use, but it is being used. We're going to need to monitor you. Call this number if you have any side effects. The side effect of that is we're going to have really good data to publish, and we are going to be able to figure out how to use peptides, because this is just the beginning, right? There are going to be some peptides out there that are going to do some really big, important things, but are also going to push the side effect envelope. That's coming. And the last thing we need, because what I'm afraid of is the same thing everyone's afraid of with artificial intelligence. There's going to be, and we all know it's going to happen, there's going to be a 9/11. There's going to be a sentinel event with artificial intelligence where all of a sudden one of these models, frontier models, breaks into some chemical plant and releases, and 50 people expire. Well, that's going to happen with artificial, and then government's going to go, okay, whoa, everybody stop. Well, rather than wait for that to happen with peptides, if we can get ahead of it and figure out this peptide works this way at this dose. And by the way, think about it, a med spa. If you can publish an article in one of our journals about your experience with GHKCU and say, this percentage of patients did nothing. This percent of patients, it made their skin this much better. This percent of the patients had side effects. Everybody's going to want to come to your med spa because you're the expert in GHKCU. So it's not only a way to avoid regulatory issues, it's not only a way to practice safe med spa providing, it's a way to amplify the field and even your individual practice.
Yeah, I think that's absolutely right. We've I've had conversations with a few folks about facilitating that and putting together for our association a journal that we can say, hey, we'll publish it, because one of the things that folks are a little nervous about is just being out there in front and saying, hey, we are doing XYZ. We're doing these types of, we're administering these peptides. We're because they're worried about what the blowback could potentially be by publicizing it, for lack of a better word, you know. But I agree. I think it's needed. All right, Dr. Terry Dubrow, I appreciate your time. Thank you so much.
My pleasure. Thank you.
AmSpa members can enjoy an additional 15 minutes of conversation with Dr. Dubrow about peptides, compliance, and his experience with fans of his television appearances. Log into your profile at account.americanmedspa.org and click on Learn in the left column to access your on-demand video resources. Thank you to our producer, Madeline Muller, marketing content coordinator, who organizes the podcast schedule and guest, and provides topics and talking points. Editing, graphics, and platform management are handled by myself, Derek Hawk, Digital Marketing Manager. Our theme is provided by Maka Music. The views and opinions of guests are their own. Mention of a product on this podcast is not an endorsement by AmSpa. This podcast is provided for information and entertainment and does not constitute legal or medical advice. For more information about the American Med Spa Association, visit americanmedspa.org.